Hi guys, here's how to give a bolus feeding via an NG tube or a nasogastric tube. So as it is, it's a tube that goes through the nasal cavity, so your nose, down into your stomach. So when you want to give one of these bolus feedings, the important thing to do is to assess the NG tube. So in the patient's, either like the nurse, the document, whoever put the NG tube in, they'll mark where on the NG tube that it was placed. So mark it right at the nose, or it should also be in the order somewhere. So marked on the NG tube are centimeters. So this one is at 70 centimeters. So I'm gonna assume the order, I'm just gonna pretend the order said that it was marked at 70 centimeters. So before I check, I make sure it's still at 70. If it was at like 60, that's a problem because it's probably not in the right place anymore. So that's the first thing to make sure, is that the tube is in the correct spot, it's marked correctly. And then also you want to look and just see there's two ports here. So this is a Salem Sump NG tube. So this clear port at the top is the port that you give the medications, the feedings, the water flushes, anything like that through. And then this blue is just for kind of like air to go through. Usually it will have this little one-way valve on it to kind of prevent gastric contents from coming up. So to give a bolus feeding, you need a 60 cc syringe. I have two of them. I have the formula or whatever type of feeding that is prescribed to the patient. So I just have one of these little Ensure guys, and then I make sure to have a cylinder of tap water. It does not matter if it's tap water or sterile water. Your intestines are not sterile, so it's okay to give tap water in this case. So the first thing, after assessing this, some facilities also have you aspirate stomach contents to check the pH, and that's just to make sure it's in the right spot. So you would just put this on, connect it to the clear, draw back stomach contents, and there's little test strips to test the acid. So the pH should be below 5.5 for the stomach. So a big thing to ensure patency is to flush before. Whenever you flush an NG tube, you want to flush with 30 to 60 milliliters of tap water. But in the orders, it will say either 30 or 60. So just make sure you check your orders to see how much. So to do that, I take my syringe and I'll put it in here, draw up the 60. I like to get rid of the bubble, just because it's not gonna harm the patient putting air in, but it's not comfortable. It can make them kind of like gassy, so I try not to. So I'm gonna flush it with the 60 cc's. I'm not gonna slam it in, I'm just gonna nicely do it. So a little resistance if there's like leftover like medications or the feeding stuck in the syringe. So sometimes you just kind of have to push against that resistance to kind of break it up. That's also why it's super important to flush with the tap water before and after giving medications or feeding, because obviously the medications, if you don't crush them up well enough, they can get stuck in the tube. Same thing with the feeding, it can dry up and get all stuck in the tube. So that's flushed, it's patent, I already assessed that it's in the right spot. The patient will also probably get routine chest x-rays just to make sure that the tube is still in the stomach. So I like to take off there and put it on here. and then I'll pour in the formula and give it to the patient via gravity. So, depending on how much is ordered, pour it in. And so giving it by gravity just means that you're allowing it to go into the tube without like forcing it in. So the higher up you hold it, you'll notice the quicker it drains. And then if I hold it lower, it goes at a more steady rate. And that's just gravity taking its effect pretty much. So obviously with this feeding, you don't want to slam it into their stomach, but you want to give it at a pretty consistent rate. So I kind of keep it level to here once I get like a good flow going. And then keep pouring that in there. And then we'll pretend that's done. Oh, as I squirt myself in the eye. Then I'm gonna draw up, we'll say my order set to flush with 60 cc's. So I'm gonna draw up the 60. In this syringe. You can also pour it from this bucket into this syringe. It really doesn't matter what you do. All right. So that's the last of the food. And then I'm going to flush it with the 60 cc's. And once again, I'm not like pushing this in. I'm just slowly doing it to make sure that the line's clear of all the food and it's not going to be all gross and stuck in there. All right. And then throughout doing that, just kind of make sure that the patient isn't having any pain with it, and that the patient's comfortable. Another thing is when you have the formula or the tap water, make sure that it's at like a room temperature before administering it, because if it's too cold, it can like shock the stomach. Same thing if it's too warm, it could like harm it. And that makes it really uncomfortable for the patient. So just make sure it's at room temperature and then clean up your mess.
Great.
So clean up, and then before you leave, make sure to leave the head of the patient's bed up at least 30 degrees after giving the feeding, because you don't want them to aspirate, especially if they're laying down, they're at a higher risk of it. So leave the head of the bed up for at least 30 to 60 minutes after giving the feeding.